So the Health and Allied Workers in Indaba trade union has expressed its disappointment at the reappointment of Nomantu Nkomo-Ralehoko as Gauteng's Health MEC. Nkomo-Ralehoko returns to her portfolio under the 7th administration as part of a government of provincial unity. She joins us now for more. MEC, a good morning to you. Thank you so much for joining us. I think there's a lot for us to uncover, but I want to start with this. Talk about your priorities as you are reappointed into this position. One thing that you want to make sure that as your tenure this time as Health MEC in Gauteng, what you want to be getting right, and then we'll get into some of the other various issues.
You know what, there are quite a number of areas that I need to touch on after my reappointment in my position as an MEC for Health and Wellness in Gauteng. By the way, which I'm honored that the Premier has done that. Because during my previous term, if you know, I was committed to yourselves to improve the public health outcomes for the people of Gauteng. And I'm still eager to continue that work that we've done, because I've left it 20 months back when we went to elections, and now I must come back and finalize that. So part of the number of areas that we made in these key areas was to have a strong foundation for the future, especially for the health services in the province of Gauteng. One of those areas, again, is to improve patients' experiences and care in our hospitals, because you know that there are quite a number of areas where we've been litigated because of us not taking care of our patients. Then we had to launch that campaign that is called I Serve with a Smile and Care campaign to enhance the staff attitudes and boost the morale amongst our health workers in our institutions. And I'm proud to say that it has borne results, because we have now a less number of complaints than we used to receive before. Instead, we get compliments in all our institutions, including the biggest institutions that in the province we've been getting those, because we've been on monthly basis do the assessments about this campaign that I Serve with a Smile, if it's working. We've rolled out to all institutions, we've trained all the health workers, we've trained even the stakeholders that we work very closely with them in the institution. Then the other one, it was the area of we made sure that, because now we are preparing for NHI, we need to have a strong foundation for successful implementation of national health insurance in the province. But looking ahead, I'm determined again to make sure, because we're building progress on that area and we're improving access to quality comprehensive healthcare services again. But again, the infrastructure is one of the areas that I promised you that we will improve. If you can go to some of our hospitals just close to you, I always tell people that just go to Bethakwa and see the type of the work that we have done there in improving our infrastructure. Besides Bethakwa, we're making inroads now, improving Bara, and Premier has given me that as one of the priorities to make sure that Bara now change, because it's one of the biggest institutions in the continent. So if you can go there, you will see the work. In fact, on Thursday, we're inviting you, because we'll be launching the second phase of the surgical backlog that we have launched last year on the 18th of July. So our infrastructure is improving. It's still old in some of the institutions, but we have this aggressive approach now that we've taken. Again, there's this area that it's critical, which I say to the team, this is the core business of the department, the preventative care and the health promotion in the department, which Premier brought it again 20 months back as part of my priorities. I have been in the communities, in the townships, in the hostels with my team, ensuring that everybody is being checked in every area. We're collecting data, by the way, now with the community health workers in every household. And we're calling that corner to corner now. We've changed it. It's Asibe Healthy GP, as you say, hashtag Asibe Healthy GP. But again, it's corner to corner now. Every street, we launched it in Meadowlands at Ward 41 with the councillor there. We're bringing in now councillors. We're integrating our work, and we want to collaborate with all the stakeholders. It was so exciting to me 2 weeks back when all the gogos were there working with me, were doing exercises, but they were checked at the same time.
Right.
And again, the old ladies, I call them our gogos by me. So our gogo were so excited because we were checked. Everybody was just freely going to those stands of the Department of Health Yes, my dear.
Okay, so let's look at some of the challenges that you are facing, though, and some of them happening, you know, at the moment. Challenges that are already on the ground. For instance, the Cancer Alliance has said that there's been no relationship between your department and themselves. They've taken this issue now to the Gauteng Division of the High Court in Johannesburg against yourself, the MEC of Health in Gauteng, and they say that this is for 784 million rand allocated to your department by Gauteng Treasury to provide cancer patients with life-saving treatment and clear radiation, saying that money has gone unspent. What happened to that money, and how much of it, in your, according to your understanding, has been spent on life-saving treatment and equipment for cancer patients in Gauteng?
It's a pity that Cancer Alliance is behaving this way that they are behaving. You know, this issue involves a tender. And it was done, and I think we are working very, very closely with other stakeholders, except the Cancer Alliance, that believes that they are entitled to the tender for this service. And I was saying with the team, it must be done through proper channels. We're not going to shortchange anyone, and the process are in place now. They've taken us to court. I'm not going to dwell much on this issue, but I want to tell you, one day I'm going to do a press statement where I'm going to expose the Cancer Alliance colleagues, because they want this thing to be given to them literally like Atamakosa and Gesikosa. And we can't do that. We have to follow proper processes. That's why now DAGs are on the roll. We are finalizing all those processes. In fact, they've been finalized, those processes. Everything is done according to by the book. You know, I'm coming from the finance background. I will never do anything that is going to take the Department of Health where it used to be. One of the areas that when I arrived, there was a problem in the Department of Health. It's supply chain processes. People will just been given the right to do, but now they have a right to approach the court. I don't have a problem.
Okay.
I will explain to the court what is it that needs to be done by Cancer Alliance colleagues if they want to benefit from this tender that is out there, by the way.
Well, I'd be keen to hear the details on what this tender that you say is really at the center of this is about, right? So what that tender is for, if you can give us those details. But at the same time, the viewer that's watching, perhaps is a cancer patient watching here in Gauteng and wants to know the state of surgery and oncology treatment backlogs in Gauteng, and if that is in any way impacted by this battle over a tender that you say the Cancer Alliance has their eye on.
Let's not dwell much on this issue because it's in court. Let's wait for the court processes. And I still maintain that I can't stop them from going to court if they believe that court will help them to do this.
But is there a backlog in cancer treatments in Gauteng, MEC?
We don't have a backlog in cancer treatment because we have other institutions that are taking care of the services that are supposed to be done. We have some of those institutions that are doing that. Charlotte Macleke is one of those. Steve Biko is one of those. And I don't understand what they are trying to say.
Yeah. Okay, because there's a report here that says that NPOs are calling out Gauteng for failing cancer patients with a backlog of more than 3,000 people waiting for treatment.
I know I've seen them doing in front of the building, and they tried to address them, but they decided then to went to court. So let's leave it at that.
Okay, let's look at other issues. There's, of course, been the issue of a hospital in Soweto, the Begimlangeni Hospital in Jabulani, Soweto, just recently having protests outside of it. Community members who claim that there'd been a history of corruption and nepotism within their hospital. Is that something that you'll be looking into?
No, we've looked into that issue. DDG Corporate Services had a session with them and the HOD, and they explained what was the problem. It's one of these petty fights that the staff members will do, but we've addressed it. Okay. Rest assured, Begimlangeni is functioning so well, and we have a very good CEO, by the way, that Begimlangeni.
Okay, can we talk budgets a little bit here? MEC, of course, at this time, budget's going to be a big issue. Do you feel that you have the resources that you need to get the job done in Gauteng?
I don't have enough resources, and I always tell the Premier through the Budget Council that health needs more money. But again, we've set up processes where we have tightened controls now in our hospitals. Remember, we're coming from the dark hole, as I used to call it, in terms of the finances of the department. So we will be getting some money, because even in the last allocation, Premier gave us some money that we should use as a Department of Health, so that we don't have a backlog, although we're still trying to clear up some of the areas like the payment of suppliers on time. It has been one of our problems. Remember, we have about 37 hospitals and 10 specialized hospitals, and we have the clinics, that all of them, we have to look into their finances as a department, and we have done that. So we've tightened those controls, including the Tembisa, that all of you knows that it used to be one of our problematic hospitals. Now systems are in place. I can't say we're on top of issues. Well, I can say, confidently say, I am on top of issues, because that area is led by me. Remember, it was part of my priorities when Premier deployed me 20 months back to the department, that I must stabilize the finances of the Department of Health. And I'm proudly saying I've stabilized those finances. In fact, I was telling Minister one of the days in our first call in his office, I told him that I'm looking for a clean audit for that department. And I'm working very closely with AG, because they do check our books. I'm working very closely with PAC. They do check our books, including other key stakeholders like your public protector, in terms of the areas that they've raised in the department that we have not been doing correctly, including the disclosure of our clinicians, because it has been a very difficult area that they didn't want to disclose in the department. So now they know that every financial year they must disclose what they are doing where in the department, because it's one of the areas that we should look into, so that people don't work in the department but they're doing other services outside, and the state is not aware of those services that they render.
All right, MEC, we really do appreciate your time. The department, of course, has been allocated 64.8 billion rand for the 2024-2025 financial year. MEC Nomantu Nkomo-Ralehoko saying they need more. She, of course, is the health MEC in Gauteng.